Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we're going to look at the principal mediators and inflammation and also the source. So to begin with, first is we look at the histamine. So histamine, the source is the MBP, that is the MBP. The MBP, it stands for, so this stands for the mast cell basophils and the platelets. Next is the prostaglandins. Prostaglandins, it includes the mast cells. So what we see is mast cell is present in most of them. So mast cells as well as the leukocytes, writing as L. Better to write it as leukocytes. So the same thing, a similar thing is present in the leukotrienes. So leukotrienes also follows the same pattern, that is the mast cell and the leukocytes. Then we move on to the cytokines. The cytokines, it includes the TNF. So there is presence of TNF, there is presence of IL-1 as well as there is presence of IL-6. So what are the source? Source includes the macrophages. So there's macrophages, there's presence of endothelial cells as well as presence of the mast cells. So macrophages, endothelial cell and the mast cells. So it is known as the MEM. Then we move on to the chemokines. So what is meant by chemokines? So chemokines, it includes the LAB. So LAB is a mnemonic for the chemokines. That is, the leukocytes are present as well as the activated macrophages. So we can write it as activated macrophages. Then comes the platelet acting factor. Platelet activating factor. So platelet activating factor, it includes the leukocytes and the mast cells. So leukocytes as well as the mast cells are present in the platelet activating factor. Then we move on to the complement. So complement, it includes the plasma which is produced in the liver. Then when you look at kinins also, it is by the liver, the plasma which is in the liver. To learn and grow daily like this, please do subscribe.